Hello. We're going to do a practical based on the lectures that we received in relation to the GIT. We were doing the hindgut. So we will have received a lecture as well as a tutorial on the hindgut. And so the practical is you will receive a practical sheet which will deal with the practical. The things you would normally have done if you were here yourself. So I will take you through the practical in about 5 minutes, and then you'll be able to write the practical report and to draw it. This is as close as we can get to an actual practical. Okay, so let's begin. We're looking at the hindgut. This is a model of the hindgut. Okay, so here we can see a model which is showing the structures of the GIT, particularly the hindgut. So we can see the parts of the hindgut, which really starts from the transverse the transverse colon here. Okay, starting from here, about, if you take the transverse colon is this part. Okay, we can start really from here, from the cecum, which is this area here. This is a small piece, is the appendix. There is this valve here which prevents stool or refuse from going backwards. This is the ileocecal valve. We'll have discussed this in the lecture. This is small bowel generally, and this is the large bowel is on the outside. This is the ascending colon. At the corner here you have the hepatic flexure. Okay, and then the transverse colon is this structure going up to here, up to the splenic flexure here where the spleen is. You will see that usually the hepatic flexure is lower than the splenic flexure. Okay, this is because the liver pushes the splenic flexure down. Now remember that we talked about features of the large bowel. Okay, it has these bandings. These are called holstrations. You see them better in the actual dissected cadaver, but for now we'll use the model. Then there's a band of muscle in the center. There are 3 bands of muscle in the center. These are called tinea coli. And on top of this bowel, you see some little pieces of fat. These are called the appendices epiploicae. Now we don't have, this is just when we do the dissection, we can show you later the appendices epiploicae. This is the descending colon coming round the way back. Now you can see that these two are behind the cavity of the abdomen. That is the descending and the ascending colon and the cecum. So they are called retroperitoneal organs. This one is in, the transverse colon is actually in the abdominal cavity. Okay, so it is intraperitoneal. Okay, so, and then on the descending, after the descending colon, the colon makes a C shape, which we can't see that very well, and then it comes round, and this is called the sigmoid colon, because it has an S shape like the sigma in the alphabet, in the Greek alphabet. And then when it comes round here, it becomes straight, and the Greek word for straight is recti, so this is called the rectum. And then the lower part here is called the anus. Little part here. Okay, you can see the Houston valves, which are these 3, 1, 2, 3. These 3 shelves, although the anatomy description is that the rectum is straight, it has these curves. These shelves help to separate the liquid part and the gas part of stool. Okay, here what we are seeing is the anus just here and the muscles of the anus. Okay, the anal sphincter bands. Here they are. Okay, right. Now, this is a separated model, but let's look at a model which has everything in place. Okay, so this model here is a model of showing the gut and showing the hindgut. Okay, so here again we can see that the large bowel is on the outside. You can see part, if I open it like this, you can see the cecum, which is this, the ileocecal valve, which I said is important in maintaining continence. Okay, in maintaining continence. All right, let's see. Okay, a little bit of clarity there about where the structure is actually, and then drawing back a little bit to get you focused in very well. Maybe a little bit back like that. Okay, so what we're saying is this outpouching is the cecum. There's a valve here which prevents stool or the material which is due for discharge from going back into the small bowel. Okay, now you can see where the blood vessels that supply the cecum, the ascending colon, the hepatic flexure here, the transverse colon, the splenic flexure, and the descending colon. And remember the S-shaped colon, which is called the sigmoid colon. The blood supply to the colon is really two. Mostly what we speak of the hindgut as starting from here. If you break this into thirds, the outer third, the middle third, and the lateral third, at this junction, this is the watershed. Everything down here is part of the midgut. Everything from here is part of the hindgut. The blood supply from here is coming from the inferior mesenteric artery, which is a branch that we can see down here. Okay? So this branch is arising from L3. The superior mesenteric artery is arising from L1, and that supplies the midgut. So if I remove all this, you will see that there's this vessel here. Okay? This vessel here is arising from the lumbar vertebrae number 1, at the level of lumbar vertebrae number 1. This is the superior mesenteric artery, and it supplies most of the midgut. Okay? Arising from here, down below, is the inferior mesenteric artery. It supplies the lateral 1/3 of the transverse colon, the descending colon, the sigmoid colon, and then eventually the rectum. These branches here create an anastomosis, okay, which are called the vessels of Drummond, and they go this way straight into the colon. And as we discussed, that as they perforate the colon here, they create weaknesses, and these may result in diverticula, which are outpouchings, a disease that is common among European, if you work among European patients, they get diarrhea, bloody diarrhea, because of outpouching in these areas where the blood vessels enter. So these arches are called the arches of Drummond. Okay, so if I remove this colon here, okay, then we'll be able to see the rectum, and we remove the uterus. Okay, so we can just see the uterus in this model is attached to the rectum. We can see the rectum going back there, down. Okay, so this in fact is the rectum. Okay, this is the rectum. This is a sagittal section of the rectum. And as I said, the name suggests that it's straight, although it's not quite straight. And it has these Houston's valves, which allows separation between the solid and gaseous component of the stool. Down below here, about 2 to 4 centimeters, is the anus. And the anus is really the one that's responsible for continence. In other words, for expulsion and release of the stool. Okay. Now, when we look at the bowel or the colon or the hindgut, we will find that the two pieces, the ascending and the descending colon, are at the back. These two behind the peritoneum, so they're called retroperitoneal. The transverse mesocolon, the transverse colon is suspended by an apron of mesentery, which we would be able to see in an actual dissection, and that is called the transverse mesocolon. And that cuts right across the pancreas, which we can see here. and then the sigmoid colon is suspended by the sigmoid mesocolon. So, in summary, that's a brief practical. It is obviously much better if you are able to dissect, but at least this gives you some practical idea of what the hindgut looks like. So we've talked about its location, we've talked about the different parts, the cecum, the appendix, we've talked about the ascending colon, the hepatic flexure, the transverse colon, the splenic flexure, the descending colon, the sigmoid colon, the rectum, and the anus. We've also talked about their blood supply and the fact that two parts of the colon suspended by mesentery, by an apron called the mesentery. And so you'll be able to now answer the questions in your practical and submit a report. If there are any questions, you can ask some questions during our next tutorial. Thank you very much. Bye-bye.